All right, so this is great. This is my first time coming to one of these events in Edmonton, and I have to say it's just so nice to see everything coming together and how Cancer Bridges is now offering these educational sessions all over the province. And I think the best thing I ever did 4 years ago was hire Janine to run this program, and subsequently Mike. So I'm really happy to see how it's all unfolding. So my research area, the area that I've been looking into a lot lately, is about complementary therapies. So I'll sort of give you an outline of what I'm going to talk about. So, what is, and this is within a rubric of what we call integrative oncology. So first of all, what is integrative oncology? What is complementary and alternative medicine? So that's what CAM stands for, or CT, which is complementary therapies. What's the difference? How commonly are these types of therapies used? Whoops, leaned on the thing. How do I get out? How commonly are they used, and which therapies have evidence to support them and for what applications. And then I'll give you a little bit of direction on how you can learn more. There's so much out there in terms of complementary therapies. I can only cover a little bit in a short period of time. So what is integrative oncology? What's this idea of integrative oncology? So we've got a little diagram here of what we call the integrative medicine wheel. And the idea of integrative oncology is really just treating the whole person. So it's not just about the physical illness, it's about the mind and the spirit, and putting together all these different types of interventions that are appropriate. So it's a collaborative, patient-centered approach to interdisciplinary care, which really just means that all the different health professionals work with the patient to give you conventional care when you need it, but also complementary approaches that are appropriate alongside that to really optimize outcomes. So it's evidence-based. There's a lot of anecdotal sort of testimonials and websites out there where you'll see, oh, this particular thing will cure your cancer, et cetera, et cetera. So we weed through all that and we actually investigate the scientific evidence, and through this integrative oncology process, provide interventions that are evidence-based. So the goal is really to increase the efficacy of conventional treatments, often by reducing side effects, improving tolerance to different drugs, reducing some of the symptoms, and improving overall quality of life. So you might have heard this term CAM, or Complementary and Alternative Medicine. So it's kind of a really vague definition. NCAM is the National Center for Complementary and Alternative Medicine in the States. It's part of the National Institutes of Health. And the way that they've defined it is a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be part of conventional medicine. So basically anything that's not conventional medicine is considered complementary or alternative. And the key element really is that for most of these interventions, there's a lack of evidence, or there's sort of key questions that have yet to be answered. So because of this sort of definition of exclusion, the therapies defined as CAM are continually changing. So those things that are developing an evidence base and are proven to be safe and effective become integrated into conventional care. So a really simple example of that is support groups for cancer patients. And 20 years ago, the idea of getting a bunch of people together to talk about their cancer experience, people didn't think that would be helpful. They thought it might even be harmful. But there's been so many studies and research over the years showing that actually this helps people, that most cancer centers now will offer that for you as part of the services provided through your cancer center. So you notice I use the term CAM, which is complementary alternative medicine, but also CT, which is complementary therapies. And we take out the alternative, essentially, because within integrative oncology, most people use therapies in conjunction with conventional treatments, not instead of them. So that's the complementary part, in conjunction versus alternative. And this is alternative therapies are where someone uses a complementary or a non-conventional treatment instead of the conventional therapies. So integrative oncology actually emphasizes the complementary approach. So using different complementary therapies to enhance well-being, improve treatment tolerance, decrease side effects, enhance the immune system, just improve overall well-being for people. So there's thousands of different complementary therapies out there, and we've divided them into 5 different categories just for an ease of understanding. So the first category is called alternative medical systems, and these are entire ways of thinking about disease and illness that are sort of a whole system in and of themselves. So they have their own diagnostic procedures and different treatments. So examples of that would be homeopathy, naturopathy. TCM stands for Traditional Chinese Medicine, Ayurveda, and I'll tell you a bit more about what these are in a few minutes. The second category we call mind-body interventions. So these are these things where they're more psychological type interventions that may have effects on a range of symptoms. So good examples of that are meditation, hypnosis, imagery, yoga. And then the category of complementary therapies that tend to be most popular are these biologically based therapies. So that's things like herbs, vitamins, dietary supplements. A lot of patients using those things. The fourth category is what we call manipulative and body-based methods. So this is where someone actually comes in and does something to your body, or you do it yourself. So massage, chiropractic are examples of that. And the fifth category is called energy medicine. So these are therapies that are centered around shifting energy flow and dynamics in the body. So examples of those would be Qigong, which is like a Chinese sort of breathing and meditation technique. Actually comes originally from traditional Chinese medicine. Reiki, which is like a Japanese hands-on healing treatment. Acupuncture with needles, you're probably familiar with that. A less commonly used one is biomagnetics, which is trying to shift magnetic energy fields through the body. So those are the different categories, and what I'll do is kind of go through the evidence category by category. But first I'll talk to you a bit about how commonly these things are used in Canada. Now this data was actually collected in 2001 and published in 2003, so it's about 10 years old. And we know that since then use of these things have only increased. But what you do see if you look across the country is that people in BC are the most common users of complementary therapies, about 60% of cancer patients surveyed there. Quebec was the lowest, around 20%, and ranging across the provinces anywhere in between there. And if you look at it broken down by men and women, what you do find is that women are consistently higher users, they're in the yellow bars, than men are, and that's across all the provinces. So the highest use group would be the women in BC, where about 2/3 of them were using some kind of complementary therapy. And if you look at it by cancer site, not surprisingly, breast cancer, because those are all women, right down to lower rates in thyroid cancer patients, prostate, skin, and right sort of ranging across the board there. And when we looked at the actual therapies that people were using back then, these are the ones that were most common, so that's the percent across the bottom this time. So you see multivitamin use, about 1/4 of the people, vitamin E, vitamin C, calcium, SCX is sort of a combination vitamin. So the most common ones are those in that biologically based therapies category. And then there's things like prayer, support groups, meditation, the sort of mind-body ones are quite common as well, or were. And you see things have changed because shark cartilage, no one uses that anymore because it's actually not been proven to be effective. So what is the evidence, actually, when we look across those 5 categories for what may be helpful? So there's a few points to consider. Yeah, so cute. So there's generally a lack of evidence for many complementary therapies. Just because, this research area is quite new, it's fledgling, there's not a lot of money to support research. So it doesn't mean that the therapies don't work necessarily, they just haven't been investigated properly yet. But at the same time, it doesn't mean that they're safe. So it's really important to realize that natural does not always mean safe. And this has been recognized in medicine for centuries that something at a low dose may be therapeutic, but at a high dose could be poison. So just because something's natural, and in fact some of the chemotherapy medications are derived from plant sources, the yew tree, for example. So natural does not always mean safe. So there is some call for caution. But it's important to find that balance, right, between believing everything you read on the internet, this extreme gullibility, and there is some sense of not desperation, but the time pressure, right? That people diagnosed with cancer, it's like, look, I'll do anything I can to help make this better, and so you can fall prey to some of these testimonials and anecdotes on the internet that they have these amazing effects. So you want to find a balance between that gullibility and extreme skepticism that, this is all a bunch of hokey, right? There is evidence for some of these things being beneficial, but it's really hard to sort through it all. And there are some very well-researched areas. So what I was going to do is show you the evidence across the 5 different research areas, and mostly just pointing out the specific therapies that we know are most helpful. So the first area is alternative medical systems, and this one's hard. I can't really say yay or nay for this because it's really hard to study as whole systems due to their complexity. So for example, Ayurveda is a whole medical system from India, and it involves a whole theory around health and illness that has diagnostic tests that go along with it about imbalances of different humors in the body. And the treatments might involve changes in diet, changes in lifestyle, different habits. The treatments may incorporate herbs, metals, minerals, massage, oils, yoga, meditation. A whole range of different things may be prescribed based on the diagnosis in this particular system. So it's very hard to study an entire system like that, although different elements of these systems have been studied kind of in isolation. Traditional Chinese medicine has been around for thousands of years, and it promotes health through this balance between opposites. So there's the yin and yang, the hot and cold, the day and night, wet and dry. And the methods used there are some similar things like diet, meditation, massage, acupuncture. There's a lot of talk about prana and sort of energy balance. There's herbal medicines, Tai Chi and Qigong are parts of traditional Chinese medicine. Yet this whole system has not been studied sort of scientifically to evaluate how helpful it is for treating different types of cancer. There is a movement towards this. I know that the National Center for Complementary and Alternative Medicine has actually funded a trial of traditional Chinese medicine for treating some forms of cancer now, but there's really nothing out there in terms of evidence base. Although again, some of the individual interventions that stem from that practice have been studied. Homeopathy is another example of a system from Europe, and this is based on the law of similars. So the idea is that like cures like, or a substance that may cause symptoms in a healthy person may ultimately relieve the same symptoms in a sick person. And this has not been tested as a sort of therapy for cancer at all. So the second category, mind-body interventions, there are a number of things that have some really good evidence showing that they're helpful. For example, hypnosis and imagery or relaxation does help control pain. It can help control nausea and anxiety during cancer treatments. And it's particularly helpful actually for kids who are going through painful procedures, but it works for adults as well. Meditation, I won't talk about it a lot, but we've been doing quite a bit of work studying meditation down in Calgary. We call our program Mindfulness-Based Cancer Recovery, so it's teaching mindfulness meditation. And we've published over 30 papers at this point and written a book, and we've proven, and us and other people around the world are now testing it as well, but it helps to reduce stress, improves mood, quality of life, sleep problems, a range of other things too actually, fatigue. We've taken blood samples and looked at how it affects immune function. We've looked at stress hormones, a range of different outcomes. And so we know that mindfulness meditation and meditation training in general is very helpful. And creative therapies, you're very lucky here in Edmonton to have the Arts and Medicine program, because creative therapies, including a range of things, visual arts, dance, expressive writing, music therapy, can really help people just cope with the demands of cancer and help with feelings of isolation and meaning and purpose in life and emotional expression. Yoga and Tai Chi are also considered mind-body interventions, and really both are forms of moving meditation. And there's a growing database amount of evidence for yoga for improving quality of life, helping people sleep better, improving mood, fatigue, helping with pain, and then also improving flexibility and strength just due to the physical nature of some of the postures. And Tai Chi as well can really help with strength, flexibility, balance, quality of life, fatigue as well. So, with any of these things, the only caveat really is to make sure that you don't have any functional limitations that might make it difficult to participate. It's always good to check with your physician, if there are any limitations. But, for example, the yoga we do in our mindfulness groups can be modified to people with any kind of limitations. We've had people in wheelchairs. We've had, a whole range of functional abilities. So don't let that scare you, if you're a little worried about it. There's a class for everybody. So the biologically based therapies, again, I think these are the most sort of confusing area, and we actually I'll tell you in a few minutes, but we started an initiative down in Calgary to try and begin to understand the evidence base around this a little better. It can be very confusing. There's a very wide array of products that are out there. There's a lot of money to be made. But studies have shown that a lot of the products can be contaminated. Sometimes they have pesticides or heavy metals in them. There may be errors in plant identification, so you think you're getting St. John's wort, but you're not. They may contain undisclosed OTC, which is over-the-counter drugs, or even prescription drugs. Sometimes they could be adulterated with things like hormones or glandular extracts if they're animal products. There may be deliberate fillers. There may be substitutions, putting in inert things just to make an extra buck. Sometimes the labeling is improper. It doesn't tell you exactly what's in it. There's false claims about efficacy. There may be adverse event effects or interactions that aren't always reported. And in some cases, taking doses of these can cause liver or kidney damage. And there may also be interactions with different medications people are taking. For example, if you're on anti-seizure drugs or blood thinners, some of these would be contraindicated. So, all that being said, if you're still listening, Health Canada has taken notice of this, and they have begun to monitor these products a little better. So there's new regulations for labeling natural health products. So if you look, there's a little label. If you go in your health food store or your drugstore and you're looking at natural health products, the ones that have been tested and sort of regulated will have a little Health Canada label on them. So they require a full listing of ingredients, and they test that regularly, and they require recommended dose, what they're actually supposed to be used for, contact information for the producer, and these are reviewed by Health Canada regularly. So there's less of a concern about not getting the right dose and having adulterated things, but it still is something to keep in mind. And it's good to talk to a pharmacist, too, about different products you might be considering. This is long, but if you just go to Health Canada and look it up, you can find the guidelines for natural health products on there. So this is really a lot of information on here, but this basically summarizes. So I had a summer student this year, and she spent 4 months going through different databases on natural health products and summarizing the evidence that was available. And what she did was summarize 879 different studies, 71 different products, and these are the products. So it lists them alphabetically, and these are the number of studies that were available, of good scientific studies that we could summarize for each product. So I've sort of highlighted the ones that had the most studies. Doesn't mean these ones are the most effective, but there's the most research on them, so we know the most about these things. So it's a range of things: beta-carotene, calcium, mushrooms, flaxseed, folic acid, green tea, melatonin, a range of vitamins here, selenium, soy. And I'll just go through some of the ones that are, I guess, the most promising. So antioxidants are a range of mostly vitamins, but oxidation is a process whereby these free radicals are formed. So there's a theory about cancer, and this really mostly pertains to cancer risk and cancer development. There's far less known about what kind of the process is after cancer's been diagnosed and treated. There's some reason to believe it might also be important. So free radicals are formed. They can cause DNA damage to the cells, and this may promote cancer development. So the idea is that antioxidants can help fight the free radicals, and they're found mostly in food sources and vitamins and minerals. So typical antioxidants are vitamins A, C, E, things like beta-carotene, the mineral selenium, which you can also get through your diet, green tea. And there is good evidence that all of these things actually can help prevent cancer, and most of it comes from observational epidemiologic research where large groups of people are followed up over periods of time, and it's observational, so they look at how much of these different antioxidants, vitamins, whatever it is, are in a person's diet, and then follow them up over many years and see who goes on to develop which types of illnesses. So basically, people who tend to consume more foods containing vitamins A, C, and E, more beta-carotene, more selenium, more green tea, are less likely to go on and develop cancers. So it's not cause and effect, but it is suggestive. But what's very interesting here is that the strongest evidence is from food sources. So not taking supplements, but getting enough of these nutrients from the food that you're eating. And we just had a speaker, actually, and this was really highlighted to me this week because we invited a speaker from the States. Her name's Dr. Wendy DeMark-Wanifried, and she's a leading nutrition scientist and dietitian from the States. And she reviewed the research looking at all these different nutrients and comparing supplements to food sources. And it was really interesting because what she showed is that people who take supplements when they don't need them may be more likely to get illnesses. So she highlighted how important it is to check your levels. Like if you're worried that you might not be getting enough of a certain vitamin, or you don't have enough iron, or vitamin D or whatever, before you just start taking all the supplements, go get your blood tested or visit a dietitian and have them assess your diet. And they can actually do that by doing a dietary recall. They plug it in their computer. The computer tells them what nutrients are in the food you're eating, and they can figure out how much of each nutrient or mineral or vitamin you're getting. And actually Mike Lang, who's been hosting us, he did a little video with Wendy that'll be on the Cancer Bridges website soon about this myth that you can never get too much of a good thing, right? Whereas actually that's not necessarily the case. So before you go and take all these supplements, you want to make sure that you need them. And it's really much better, the research shows, to get them from food sources than to go and take pills. Because, the pills aren't the same as the food, right? It's just one particular strain of the vitamin that you're getting. You're not getting the full complex. You're not getting it in context with all the other things that are in the food. Okay, so there's other things that have been identified for decreasing risk. So we can recommend these will decrease risk of getting cancer to begin with. Whether they make a difference for survivorship, the evidence really isn't enough to convince you, but there's reason to believe it may be promising. So lycopene is a substance in tomatoes, and this has been shown to lower risk of prostate, lung, stomach, pancreatic cancers. They call these alums, garlic, onion, leeks, chives. These have been implicated in decreasing stomach, colon, and prostate cancers. Shiitake mushrooms, again, a good thing in the diet. Turmeric, this is that sort of yellow spice you often get in Indian food. Again, has been associated with decreased risk of colorectal cancer, and it has, in the lab, anti-tumor and antioxidant effects. And then there's some herbs and supplements that can help decrease some of the side effects or symptoms associated with different cancer treatments. So there's an amino acid called glutamine, which seems to help decrease chemotherapy-related symptoms such as like the tingling in the hands and feet and numbness, that neuropathy. Mucositis, which is like sores in the mouth, and often people have GI problems. It might help with that. Ginger is very helpful for combating nausea. There's quite a few trials, and this is quite interesting, that melatonin. So melatonin is a hormone, actually, that's secreted naturally by your pineal gland in the base of your brain, and it helps you sleep. So it's secreted at sleep onset. But they've done some studies, mostly in Italy, where they have added it to chemotherapy regimens and shown improved survival across a range of different types of cancer. So if that's something you're interested in, I encourage you to go and get some more information online, and I'll show you where to go to get that at the end. So there's also this thing called the Coriolis mushroom, and that's a picture of it right there, actually. It's also called turkey tail sometimes because it kind of looks like turkey tails, yeah. And it's been used a lot in Japan in a lot of clinical trials where they combine it with chemotherapy, again. I think it's 30 grams a day or something like that, but again, I'll show you where to get the details. And it has improved survival across a number of different studies and a number of different types of cancer. It's very interesting research. So it's hard to say conclusively that these things will help, and it's also very individual. It depends on what treatment people are getting, what type of cancer, what stage it's in. It's very nuanced using these different kinds of interventions. So the recommendation is not across the board for everyone to start taking things, but to look into it a little bit further and try and understand if it may be helpful in your situation. So a word about nutrition as well. There is lots of evidence for the merits of a plant-based diet. So eat your fruits and veggies, right? Your mom was right 40 years ago. It's still true. It's boring, maybe advice, simple, but fruits, vegetables, whole beans, legumes, lentils, that kind of stuff, whole grains, so not processed food. And there's very strong evidence that eating a diet like this can prevent cancer occurrence and recurrences. You should avoid red meat. I know this is Alberta. It's not popular advice, maybe, but there is quite a bit of evidence showing that red meat consumption is associated with higher risk for mostly colorectal, but bladder cancer, a range of esophageal. And again, try to get your nutrition from food and not as much from supplements, and not if you don't need it. So the fourth category is these manipulative and body-based complementary therapies. So massage is helpful for decreasing muscle tension, not surprisingly reducing pain and anxiety, but it can also help improve sleep. And for people suffering from lymphedema, and when the lymph nodes are removed, often in the armpit or in the groin, there can be painful swelling, and lymphatic massage is very helpful for that, or it can be. Chiropractic is helpful for pain relief generally. There's research. There's not as much within a cancer context, but it's certainly something to investigate. And I'm not going to talk too much about exercise. We have, actually here in Edmonton, is the world leading exercise and cancer prevention and treatment researcher, Kerry Cornier. And many of you may have been in his studies. I wouldn't be surprised. But along with nutrition and diet, exercise is the single most important element in cancer prevention without question, and it's looking now like that's going to be the case for preventing recurrence and survival as well. The recommended amounts are 30 minutes a day at a level that's moderate exertion. So whatever it takes to get you puffing slightly, whether that's walking quickly or running fast, if you can do that for 30 minutes a day, you are improving your chances across the board, and you'll be happier. Okay, energy therapies. So an example of a well-researched energy therapy is acupuncture, and it is helpful for treating pain. It can help with nausea and those hot flashes associated with some of the hormonal therapies. It may help with peripheral neuropathy, so that pain and tingling in the fingers and toes. The evidence isn't quite there to definitively recommend it. Wrist acupressure is a real simple one. You just sort of take two fingers and press them on that little, there's sort of a band of cartilage, or I don't know what it is, a nerve just on the inside of the wrist. And you can find this online, and it actually helps to relieve nausea, so that transient kind of nausea you may have in treatment. And then Reiki, I mentioned that's a Japanese hands-on healing sort of therapy where you'll be lying on your back, kind of on a massage table, and the Reiki therapist takes their hands and places them for a fairly long period of time in different positions right down your body. And there's research, and in fact, one of the lead Reiki researchers is here in Edmonton too, Dr. Carlson, showing it improves fatigue, it can help with mood, and just overall quality of life. Healing touch is similar to Reiki, except actually it's kind of, the name is a little bit of an oxymoron because they don't touch you. The hands actually hover over your body, but it's the same idea of transferring energy. And so those things can all help across a range of quality of life outcomes. Early acupuncture. I love this one. Hey, so there's the natives with the arrows, and he's like, that's odd, my neck suddenly feels better. So a little bit of advice for choosing someone to help you get your complementary therapies. The first piece of advice is ask people you trust for a recommendation. So for example, if you are really interested in some of the herbs or vitamins, a naturopathic doctor is a good person to go to. They're called NDs, and they have 4 or 5 years of training. They're an actual doctor. They go to something similar to a med school. They learn anatomy and physiology. And ask the professionals. So find out what licenses or certificates do they have. Did they do an online course for a weekend, or did they go to school for 5 years? Do they belong to a professional association? Are they regulated? Where did they get their training? How long did they train for? And things like, how much is the treatment going to cost? What's the recommended course of treatment? If it seems outrageous, then you're best to shop around, and make sure you know what the going rate is for some of these services. And for some things like massage or physiotherapy, check with your insurer because some of the cost is covered, and certainly to see a psychologist. Of course, you'd go to the psychological and spiritual care services here at the Cross, but even outside, some of those services are covered through your employee assistance program or through Blue Cross. And are the claims they make reasonable? If it sounds too good to be true, it probably is. Good rule of thumb. So before you make any decisions about using any of these complementary therapies, it's really good to go and get all the detailed information for yourself. This is a really good website. It's through the Memorial Sloan Kettering Cancer Center in New York, which is one of the 2 biggest cancer centers in the States. And you can search on there byproduct, and it's specifically for cancer. So say you put in Coriolis mushroom, it will bring up a ton of information for you, and you want to look for things like what are the side effects of it? What are the interactions? They may be interactions with certain drugs or medication. What are the contraindications? And then you can take that information, discuss it with your doctor or your pharmacist or wherever your situation is. One of the problems with complementary therapies here in Alberta and elsewhere too is that there is no standard training program for healthcare providers. So you may know more about these therapies than your doctor does. And they don't get training in it, standard training. So a program that we're developing down in Calgary right now is an education program, not only for patients but also for providers, so that they're better able to at least refer you to good, reliable sources of information, have that conversation with you. And the idea is moving towards a model of true integrative oncology, where there's one place you can go to, you can get a consultation that takes into account all the different therapies that might be helpful for you across, a whole range of different interventions. So that's my dream. That's what I'm working towards. So one day we may get there. For now, these are helpful sources of information. MD Anderson as well has reviews of different therapies. This one is a really good information on diets, and these are not cancer specific, this one, but it's a searchable database and has lots and lots of information about a whole range of drugs, herbs, supplements, other chem therapies. This is a program at the BC Cancer Agency with quite a bit of educational information for patients as well, so you could go there. That's contact information for me, and you've got the cancerbridges.ca website. We're hoping to get that information from the review we did of natural health products up on cancerbridges.ca, so we're working on that to make it a searchable database as well. If you want any of the information I've talked about and you didn't have a chance to write it down, you can just send me an email or go to my website. And moderation in all things, and I'll go back to that in case you want to write it down if there's any questions. Thank you.